Today we're going to talk about EKG basics. This is going to be like a 101 first class for EKG. So I'm going to go ahead and share my screen. We're going to go over this PowerPoint. So just give me 1 second. I'm going to play this PowerPoint here. Okay, it's coming through. All right, again, basics. This is for 2330 CVTT. All right. On this placement here that we're going to be working on, we have a person, and I put a 5-lead placement here. It's a 6-lead, 5 electrodes. That's what I meant. So when we have people or patients coming into the cath lab, to the OR, to the ER, or whatever the case might be, the first thing that we're gonna do is EKG placement. This is where the most mistakes happen on EKG reading placement. So make sure before you do any placements, your patient's skin is clean, is not oily. You might need to shave a little bit, shoulders, especially in males. Make sure also your patients don't have any device, but where you put the placement, like a pacemaker, they might have a Quinton or anything that is within the area. So make sure that you ask questions before you do the placement, do a visual assessment. All right, so when we do this first 6-lead EKG, we're gonna have 5 leads, and these are the colors that we're gonna have. So we have the white electrode, and this is standard in all the cath labs. The white electrode is going to be placed on the right arm or on the right shoulder. Please make sure you find a meaty area where you can place that EKG electrode. If the right arm is white, therefore the left arm is going to be the black electrode. We're just talking about placement right now, and then we'll talk about the leads. The next electrode is going to be the green one, and that one is going to be on the right leg, or more likely we're going to place it on the right hip. We don't go all the way to the leg. We do in some EP cases, but for the cath lab, or typically is on the hip. Now here, your red electrode is supposed to be the left leg, but guess what? I put left arm. Well, it goes on the left leg or hip. And then your 5th electrode that we have is the brown one. That one is ground, and I want to say most places, or the indication will be in the center of the heart. That will be ground. But we are trying to look at the heart, even though some of the electrodes are supposed to be radiopaque. Sometimes they're not. So we're going to try to get, and then plus the wire, the middle of the chest, etc. So we're going to move that electrode onto the left hip next to the red electrode. Tell me what you see on your in your clinical sites. There are different placements for that electrode, that specific one. All right, so moving forward, I removed my person here. This 5 placement, the 5 electrodes are going to give me 6 views. The first 3 views are going to be called bipolar leads. Bipolar leads means 2 electrodes, 1 positive and 1 negative. We're going to start bipolar leads. We're going to start with lead 1, which goes from the right arm to the left arm. So it's going to send the signal from the right arm to the left arm. This is kind of important to see where the vision is coming from. So I put a little eye because this is where we're looking, from where we're looking. So I'm looking from the right arm to the left arm. So my vision is going that way. It is also important to know that in this lead, the right arm is negative charge and the left arm is positive charge. The second lead is going to be lead 2, and it goes from the right arm to the left leg. We can also say about the green electrode here is going to help us ground more than any use that we can give it. So right now, lead 2 is going to be right arm to the left leg. In this lead, your right arm is still negative. Your left leg is going to be positive. If you see, the right arm keeps negative, so therefore that's where I'm looking from. And then we have lead 3, which goes from the left arm to the left leg. And let's take a look at the charge here. The charge is negative on the left arm. That means I'm looking from the left arm down to the positive to the leg. That will make lead 3. So we have 3 bipolar leads, 1, 2, and 3. It is important to know that the charge changes on the left arm depending on the lead, and there's nothing that we have to do. The EKG machine will calculate like that. It knows if the placement is good, it will know what lead 3 means and to change the charge. Okay. This is what it looks like in the 8 of its triangle. If you remember, lead 1 goes across from the right to the left arm. So therefore, this is what it looks like in a star or in a circle position. Lead 2 is going to be from the right shoulder to the left leg. And then lead 3, if we were to move this lead, I put it together to make it central to the X. But if I move this lead more laterally to the left, it will look exactly like our previous one here. So it's if I just adjusted the movement of these leads. That's what they look like, and remember the charges. This is very important. Okay. Those were the first 3 leads of a 6-lead EKG. Second 3 leads are going to be called unipolar leads. Unipolar means they only need 1 charge. They don't need, it's not bipolar, they don't need positive, negative. However, the cells in the body are negative. So we are going to count the brown electrode, remember it was in the center of the heart, as being negative because it's coming from the center. So it is important. We're going to be using, if you remember the positioning of the bipolar leads, it's the electrode right, it's white, the left arm is black, the left leg is red. We're going to keep using the same. The machine is going to do this for you. It is the same electrode position. It's just going to take it from a different angle. When we do the right arm is going to be AVR, which means augmented voltage right. Therefore, the black electrode is going to be augmented voltage left. And guess what? AVF represents augmented voltage foot. Aha. Okay, so in these leads, we are going to be seeing from the heart, because remember, we are looking from the negative space. So from the heart, AVR is going to look out to the right, up to the right, AVL up to the left, and AVF down to the foot. So this is important because further down in another class, we're going to be seeing what are the areas of the heart that each lead is looking at. But if you can kind of start putting things together, we're going to know that AVF is going to look at the inferior part of the heart, or the apex. Okay, so when we add the unipolar leads to this star or this circle, this is what it's going to look like. And it's important to know that they do have representation all the way 160 over this circle. So it looks like we pretty much have all the areas covered, right? Okay, so this is when we talk about 6-lead EKG. So what happens when we move to a 12-lead EKG? We're going to add 6 more electrodes, and these are going to produce precordial leads. So it's going to be the first 6 leads plus 6 precordial leads. In the case of the precordial leads, we're going to have a horizontal view of the heart. This one is no longer superior, inferior, or laterals. This one is going to be totally horizontal. These are called, or the name is V1 through V6. Let's take a look at the positioning here. The most important thing to know about precordial leads is positioning. What are the landmarks for positioning? This is probably testing material. The first lead, or V1, is going to be on the fourth intercostal space. I guess let's just go back. B1 is going to be, as you can see here, we're going to find the sternum. Then we're going to find the fourth intercostal space. So we're going to count 1, 2, 3, and 4. And you're going to place your first electrode right outside the sternum. V2 is going to be exactly opposite on the other side of the sternum, fourth intercostal space, and that's going to be V2. Now we're going to leave V3 alone for a little bit, and then we're going to move to V4. V4 does have specific landmarks, and the first landmark is fifth intercostal space and a mid-clavicular line, which is this blue one that we see here. So V4 is going to be placed fifth intercostal space, mid-clavicular line. So you're going to find on your patient your clavicle and determine more or less what is a midline, and then go down one spot on the intercostal space, because you were on 4 for 1 and 2, and then on 4 you go down 1 intercostal space. So those are the two landmarks. Once you place V4, then we can place V3 right in between V2 and V4. And then we're going to leave V5 alone for a second. Oh, there it is, mid-clavicular line for the fifth intercostal space. And for B6, we're going to find mid-axillary line. And we're going to remain on the fifth intercostal space. So 4, 5, and 6 are going to be on the fifth intercostal space, going a little bit more lateral. Mid-axillary line, so you're going to determine, mid-axillary line on your patient. Every patient is different, so find the space, and then once you place B6, and then you place B5 in between B4 and B6. Okay. So when we take a look at this, is a little bit like a close-up of the positioning of B1 through B6, so you can have a better idea here. And we have a little shade of the heart here. So this is going to start giving us an idea that the leads are going to look at the heart from each position. So let's take a look at this. Take a look at B1. B1 is going to look at the heart. It's going to look very closely at the septum, because it's right. The heart is right in the chest, right in the center of the chest. It's not really on the left, like we believe to be, is right in the center. So therefore, when V1 is going to look exactly at the septum, and so is V2, just from the other side. So these two leads are going to look at the septum. And then we're going to have V3 and V4. V3 is going to look more anteriorly, and so is V4. So all these 4 leads, V1 through V4, sometimes they're called anteroseptal, because they look at the anterior part and at the septum. So it really depends on the author, what are they saying. But when you hear anteroseptal, that means one section looks at the anterior part and one section looks at the sternum, anteroseptal. And then we're going to move to, this is V4. Now, when we move to V5, remember the heart is a little bit now tilted a little bit towards the left. So V5 is actually going to look at all that LAD that goes down the ventricle, because it's very, it has like a front view on this area. And then we move to V6 and look at what V6 is looking at also. In another class, we're going to see what are the areas that each lead give us EKG information. And this is that was it for EKG basics.